بسم الله الرحمن الرحيم. Allergic bronchopulmonary aspergillosis ABBA. When to suspect? We suspect allergic bronchopulmonary aspergillosis when in a patient with asthma or cystic fibrosis who presents with these findings: eosinophilia, elevated immunoglobulin E, dramatic response to corticosteroids. The aspergillus colonizes the airways and incites a vigorous immunoglobulin E mediated response. The immune response leads to bronchial obstruction, bronchiectasis, and eosinophilia. Features of allergic bronchopulmonary aspergillosis include eosinophilia, elevated immunoglobulin E, and dramatic response to corticosteroids. How to diagnose allergic bronchopulmonary aspergillosis? We diagnose it by doing a skin prick test for aspergillus, which is positive, and elevation of immunoglobulin E levels more than 1000 nanogram per milli, and the positive precipitin to aspergillus will confirm the diagnosis. As we know that bronchiectasis is abnormal and permanent distortion of one or more conducting bronchi or airways, most often secondary to infection, and typically presents with chronic cough and symptoms and signs of what's called suppurative lung syndrome, which is where there is increased production of cough, which characterized by bad smell, bad odor, and is mucopurulent sputum, colored or discolored, abnormal discoloration of the sputum, and related to posture, specific postures. So again, bronchitis, as we know, characterized by suppurative lung syndrome symptoms and signs, which include paroxysmal cough, which characterized by large amount of sputum, discolored, maybe greenish, yellowish, has bad odor, maybe offensive odor, related to specific posture, as for example, if the bronchitis in the the cough and the sputum amounts will increase when the patient sleep on the left side, if the bronchitis in the right lung, and the reverse is true. And if the bronchitis is present in the lower parts of the lung, it will increase, the sputum will increase on leaning forward.